go back to the beginning. There we go. So hi, I'm Emily, and I'm going to be talking about testing for intestinal parasites. So why and what is a diagnostic-led worm control program? So all horses, ponies, and donkeys are exposed to some level of gastrointestinal parasites. But how we control these parasites is essential to horse health, performance, and helping minimize drug resistance. Essentially, we have 3 different types of tests that we use, and we perform these strategically at different times of the year to tell us whether or not we need to worm our horses and what we need to worm them for. So why should we be using a diagnostic-led worm control program? There is increasing resistance to wormers, and as Natasha has quite rightly said, there are no novel types of wormer in the pipeline. Due to decades of frequent use of wormers, we have, unfortunately, with some types of parasites, we've selected for high levels of drug resistance, particularly in our small red worm and our Parasite populations. On the whole, blanket worming is an outdated strategy because the worms that are able to survive the killing effects of the wormers, they then pass on their evading techniques onto their offspring, leading to higher drug resistance. So to reduce resistance in the future, to reduce further resistance, we need to ensure that our wormers are only used when they're genuinely needed to. So when testing detects that horses have a worm burden that requires treatment. Regular testing also helps us to identify those horses that are more susceptible to worms or have persistently high burdens, and for us to try to work out why that's happening, and if there's anything we can do to help that, whether it's a management problem or it's maybe the horse is slightly immunosuppressed. So these are the types of tests we have available. Most of you will be very familiar with all of them, but we have, so the first one being fecal egg counts, otherwise known as worm egg counts, and that is using a poo sample. Then to test for tapeworm, we look for the antibodies, and we can either look for the antibodies in the saliva, or we can also look in the blood, so we do a blood test. The same goes for looking for a cystic red worm, and that is also a blood test. So starting with fecal egg counts, they allow for detection of the adult strongyle egg, so the egg-laying adult strongyle species, the Parasite species, and strongyle eggs. So fecal egg counts should be taken 3 times a year, around 3 months apart. I know it sounds like I'm missing one or I can't count, and I think there are 9 months in a year, but I will explain that later. As Natasha has already discussed, fecal egg count reduction tests are really useful. So what you do is you repeat your fecal egg count 3 weeks after worming to ensure that your worming has been effective and the resistance isn't a problem. This test would be recommended if your horses come back with a medium or a high egg count. At the time of writing this talk, the cost per sample is £13.11, including VAT. And if multiple samples are submitted at one time, the price will decrease. This is how we work out the fecal egg reduction test. So we take the eggs per gram pre-treatment, and we minus the eggs per gram 21 days after treatment, divide that by the pre-treatment eggs per gram times 100, and that gives us our fecal egg reduction percentage. A result that is less than 90% reduction would raise concern about concern about resistance to wormer that you've used. So, how to take an accurate sample? I know most of you do this incredibly well, but I'll just outline a few points. So the fecal sample must be collected from fresh droppings and then placed in a clean, sealed, labeled sample pot or something similar. You name it, we've seen it all, whether it's jam jars, Tupperware, sandwich bags, all of those are very useful, but we do have sample pots in the clinic, which we can post out to you, or you can collect from the clinic. Our lab ladies will be very impressed with your vet if you arrive with a nice sample pot, and we'll get gold stars, and the lab ladies will be very happy. If you know that you're going to test a whole yard and you're going to be bringing lots in. If you let us know, we can send pots out to you, but also we can give the ladies in the lab a heads up to know they're expecting a large load. Try to not include large amounts of bedding in your sample. Another point is that eggs aren't always evenly distributed in the droppings. So taking a pinch from several fecal balls is ideal, 4 to 5, and the sample should be golf ball sized. Ideally, if you can drop the sample straight into the hospital within a couple of hours of taking it, and keep it out of direct sunlight. If you can't drop it straight in, please keep it refrigerated until you can drop it in. Ideally, we like to run samples within 2 days of being collected. Samples that are old or left in warm places give us less accurate results and can lead to incorrect worming advice. So when the samples are in an aerobic environment and also in a warm environment, the eggs can actually hatch, which means we can't count them. So it will lead to a lower worming count. So what happens in the lab? So our lab, where they'll mix the sample up, and it's put into 1 gram is put into a concentrated, it's like Epsom salt solution, and this causes the eggs to float to the top of the sample, and they stick onto a glass slide, which we then look at under the microscope. On the left, you can see this is a strong egg, and on the right, the brown eggs that look slightly like a sliced Scotch egg are the Parasites. So your fecal egg count results, generally under 200 eggs per gram is considered low count, and we don't usually recommend worming these horses. But it is, each case we take into consideration your horse's history, the type of yard. So in some cases we do recommend worming under 200 eggs per gram, but we will discuss that if that's the case. 200 results between 200 and 1,000 eggs per gram are considered medium, and your horse will need worming. We can advise on which wormer, as Sarah will be discussing that later, which wormer we would recommend and for what type. Results over 1,000 eggs per gram are considered high, the horse will need worming, and possibly we'd be looking at your parasite control measures, and Sarah will be discussing that, and whether anything can be improved. With ascarids, a result less than 50 eggs per gram is considered low. So moving on to tapeworm. So as Natasha has discussed, tapeworm eggs won't reliably show up on a standard fecal egg count, as their eggs are contained in segments within their own body. So if your horse comes back with a low fecal egg count, they still could have a tapeworm burden. We can test for tapeworm using a saliva test, which can be done by you and sent to a specific lab, or it can be done by a blood test taken by your vet. Testing should be done twice a year, around 6 months apart, ideally in spring and autumn/early winter. So how does the testing work? So in both blood and saliva test, we measure the level of antibodies specific to antigens that are secreted by the tapeworms themselves. The level of antibodies has been shown to correlate with the tapeworm burden. Antibody tests can remain high post-worming, and this is just the way our body's immune systems work. The antibodies will hang around after the insult has gone. So the antibody tests can remain high post-worming, as antibodies take a couple of months to decrease. So these tests are not as useful to monitor effectiveness of worming for how effective worming for tapeworm has been. They're not quite as useful in that regard as our fecal egg reduction tests. So the type of saliva test we have available is the Equisal tapeworm test. It uses saliva instead of blood, so you can collect it yourself. You send the sample away, and your vet will let you know whether or not worming for tapeworm is required. The level of tapeworm specific antibodies in the saliva have a strong correlation with both tapeworm numbers and the number of antibodies that are in the blood. So salivary tapeworm specific IgG antibodies are part of the mucosal immune response to tapeworm infection. When compared to humoral antibody responses, these are the antibodies that are found in the blood. The mucosal responses have been shown to persist, to have a shorter persistence. So there would be less memory. So the tapeworm antibodies in the saliva will decrease slightly quicker than those found in the blood. So the company, Equisal, they recommend with initial testing that your horse shouldn't have been wormed for tapeworm in the 4 months previously to testing. If your horse has had a previous borderline or moderate high diagnosis, a retest can be carried out, but 2 to 3 months after deworming for tapeworm. Data shows that in most cases, reduction in tapeworm specific antibodies in the saliva can be seen within weeks following treatment, but that's not in all cases. Hence, so we leave out the 2 to 3 months. At the time of writing this talk, the cost of a saliva kit from the Sussex Equine Hospital is £22, including VAT. And you can see in the photo on the left, that is a client collecting a saliva sample. So the tests, I have actually put one here. The tests that are easy to use, and oh no, here it is. Just put it on the other side. Nice little neat tests with very detailed instructions, and there are also videos available on their website. The main pitfall is that if people allow their horses to eat or drink before the sample is collected, so horses must not eat or drink or be exercised at least 30 minutes before collecting the sample. So we would advise horses to be tied up and just make sure they can't have access to even tiny morsels of hay or salt licks. Generally, they're really well tolerated by horses, even those that are naughty to worm, and owners are normally very surprised. Essentially, you have a swab on the end of a plastic handle, and there's an indicator at the bottom of the swab, which will be white. And you pop the swab in, and around where the horse would put the bit, and the horse will hopefully gently chew and move their tongue up and down. You can encourage them to create saliva by moving the swab up and down. Generally takes about 30 seconds to collect a sample, but the indicator on the bottom of the swab will turn pink, and that's when you know it's ready. And then you'll put it in a transfer medium and send it off to the lab. Moving on to the blood test, looking at the antibodies for tapeworm. So this test works in the same way that the saliva test works, but instead the antibodies are detected in the serum of a clotted blood sample. The test does not provide the exact number of tapeworms present, but it provides a low, borderline, or moderate high diagnosis. The samples are sent away to an external lab, so just have to allow a little bit more time to get your results back, but they should be back within the week. At the time of writing this talk, the cost of the lab fee is £24.96, including VAT, but with a blood sample, a visit charge and professional fee may apply. So these are the charts that help us interpret results from the blood test and from the saliva test. So you are given in both a low, borderline, or moderate high results. So these are the results from 3 horses. So in studies done by the company that make the saliva test, so a low diagnosis, most horses had no tapeworm. A borderline, they had 1 or more tapeworm, and a moderate high, they had over 20 tapeworm. So horse number 1, well, pony actually for number 1, he is on a small yard with a very good worm control program, and this was just part of their routine testing. And you can see that he has a low diagnosis and there is no need to worm him. Horse number 2 had recently been imported. We had no worming history for him, and he looked well, and there was no reason for concern other than the lack of history. He was placed in isolation, and his owner took a worm egg count and also a saliva test, and it came back as being moderate high, so he was wormed for tapeworm. Horse number 3 was a young horse who the owners that I spoke to on the phone, they were just concerned it didn't look great, or didn't look great, it just wasn't thriving. So they performed a tapeworm saliva test and also a worm egg count. Again, that has come back as moderate high. And we wormed both horse 2 and 3 for tapeworm. So moving on to our encysted redworm antibody test. So this is, as Natasha said, it's the newest kid on the parasite testing block, and until 2019, it was not possible to test for encysted redworm, as fecal egg counts only detect the presence of the adult egg-laying worm. When horses harbour a large burden of encysted redworm that emerge en masse from the intestinal wall, clinical signs develop such as diarrhea and colic, which can be fatal. Moxidectin is the only wormer capable of eliminating these encysted stages, for which worm resistance isn't widely spread. To protect the effectiveness of this worm, targeted treatment programs are required to ensure the drug is only used when it's really needed. So a blood sample is taken once a year in late autumn, early winter, and it can be done at the same time as the autumn tapeworm blood test. It detects the antibodies to small red worm larvae, and like the tapeworm antibody test, these antibodies to the small red worm can remain high post-worming, as antibodies take a couple of months to decrease, which makes it not quite as useful as monitoring the effect of your worm. At the time of writing this talk, the cost of the lab fee is £24.96, including VAT, visit charge, and professional fees may apply. So this is how your results appear. The serum score is the relative concentration of antibodies for encysted redworm. The probability of the total worm burden is a statistically derived probability that a horse is infected with a burden greater than a given threshold. As a rough guide, a horse with a probability over 25% would be considered for treatment with moxidectin. Then just move on to just information about these horses. There we go. So horses 1 and 2 were both from different yards, but had a good worming history and good management. Horse number 1 had not been wormed for around 6 months. You can see that they both have a low serum score and a low total worm burden probability. So the risk of these horses having a worm burden is low. There was no need to treat these horses for encysted redworm, and they had both had low tapeworm results at the same time. Horse number 3 was a horse that had colitis, and we thought that was likely due to an encysted redworm problem. His serum score, you can see, is very high, much higher than 1 and 2, and his total worm burden probability was also very high. He had a very vague worming history, and he ended up doing very well. Horse number 4 was a horse that had clinical signs of a worm burden, but was on a worming schedule. His overall serum score was high, but the burden was slightly less than 3, but still likely to have a significant burden and was wormed with moxidectin. Horse number 5 was a 3-year-old who had colitis but was poorly, but we were able to manage her on the yard. And I thought this was likely due to encysted redworm. You can see she's got a high serum score and also a high probability of total worm burden, being over 1,000. She also had the same problem last year with the same clinical signs. So with this horse, we had to think whether there was either a management problem, well, not a management problem, but management that could be improved, and also whether the horses were being tested and wormed at the right time of year. So this is looking at what we believe is our ideal testing program. So if we start in January, we'd be aiming to do, or January, February, doing a worm egg count. then moving forward to April and May, doing a worm egg count with a tapeworm antibody test, and that can be blood or saliva. Moving forward to July and August, another worm egg count or fecal egg count, and moving on to October and November, and this is when we would do a blood test for encysted redworm and tapeworm. So this is the gap where I thought you'd think that I'd could count and was missing out worm egg count, but this is where we do our test for encysted redworm. So for example, if you did a fecal egg count in January, your next fecal egg count would be in April. And if you do a tapeworm test in May, your next tapeworm test would then be in November. The testing intervals are based on pre-patent period, as Natasha discussed. And they also are looking at the life cycles for the different parasites. Fecal egg count, we're aiming to do every 3 months, the tapeworm every 6 months, and doing the encysted redworm once a year in autumn, early winter. So take home messages, and this is my co-pilot looking wistfully over the downs. Take home messages that diagnostic-led worm control programs are going to be the future, mainly because we don't have any new wormers on the horizon. Fecal egg counting 3 times a year, 3 months apart. Test for tapeworm antibodies every 6 months, and test for encysted redworm antibodies once yearly in late autumn, early winter. And if you've got any questions, there we go. I'll just change that back to Ed.
Okay, thank you, Emily. That was a very, very interesting talk. I think it's quite exciting, these new ways of testing the blood test for the encysted redworm, and certainly the saliva test. They seem to be revolutionizing the way we can look and see whether or not horses have got problems beyond the conventional worm egg count and so on that we've done previously. I've got a couple of questions. You talked about the saliva test, and you talked about the humoral and the mucosal antibodies. Can you just explain a little bit more about the significance of what you were trying to say there? Can you just explain why one might be a little bit more advantageous than the other?
So with using the saliva test, you can look slightly quicker at whether the antibodies are dropping. So because there is a shorter memory with the saliva, the antibodies should drop slightly faster. So you can use that test to retest in 2 months afterwards to see whether your worming for tapeworm has been successful.
Yeah. So basically, because we're looking for an antibody, once you've had a bug in your system, those antibodies are going to be around for quite a while. It's not like doing a worm egg count and then retesting after you've given a wormer to see whether or not you've actually got rid of the worms that are producing the eggs. The antibodies are going to hang around for a bit. And trying to find a test which is showing a drop in antibodies is more useful than one that just picks up antibodies, because you're not going to be able to tell whether or not worms are there or not there from a simple antibody test. One question that's been raised was, if horses are not turned out, how do they get worms?
That is a very good question, Ed. And they could potentially be brought in on hay, or I might have to pass that on to one of my colleagues.
Can I pipe in there? So
yeah.
I mentioned with the tapeworms, it can actually be on the forage mites. So you don't need to be on the pasture to get tapeworm. So that's one of the ones that you can definitely get. I also discussed obviously how long sometimes these horses have life cycle. A lot of horses, the worms have life cycles that are quite long. So your horse may have not been turned out for 6 months, but they could have been harbouring the small redworms for up to 2 years. So it may be that actually, even though it hasn't had any pasture access, that could be a possibility. The other thing is obviously poo is passed in the school. and out in the yard, and in different stables. So if you move your horse from one stable to its next door friend, and that obviously, so it doesn't need to be grass. It's more that we're seeing transmission through the intermediate hosts, so the flies for some of these parasites, and also obviously for the poo. So it's not really the pasture that's the problem, it's the poo and the other intermediate hosts. So it is definitely a possibility.
Thank you. Another question that was asked was, if you were taking a horse to a new yard, what would be the best thing to do? Would you just worm the horse before it goes to the yard, or would you advocate one of the many tests or some of the many tests being used in conjunction with each other before doing any worming? What would your advice be?
I think Sarah's talking about that.
Oh, I will save that for my colleague Sarah.
Oh, Sarah's going to talk about that. I'm sorry, I didn't realise. I apologise. Don't want to steal Sarah's thunder. Testing seems to be quite expensive, and compared to worming, I mean, certainly you've given a real detailed description of all the different tests that you can do, and you've also illustrated what the costs are. And if you were to add it all up, it does seem quite a lot. Can you just give some pointers as to why people should invest in the cost of doing worm egg counts? What would be your main reasons for encouraging the equine owning population to actually make use of these tests? What would be your main reasons for wanting them to do it, basically?
The main reason really is because we are all going to be susceptible, or our horses will be susceptible to resistance or parasite resistance to wormers. So we need to act as a whole community in trying to minimize this getting any worse. Because the cost of a horse coming into the clinic that has colitis due to encystic redworm is extortionate. Well, not extortionate, but it takes a lot, it costs a reasonable amount of money to save them. So it's better to invest your money in doing accurate testing and saving for the wormers for the horses that actually need them. So it's more, I think, for the greater good, I think would be the answer. Ed.
Yeah, no, I think that's a good idea. I was basically just wanting you to reiterate the fact that we aren't getting any new wormers, and resistance to wormers is a huge problem, as is resistance to antibiotics and all of those sorts of things. So just, can you give me a comment on the accuracy of the results that you might get if someone were to send a sample for a worm egg count through the post compared to it being done very quickly in a local clinic? Are there advantages to doing it quickly? Are we going to get a better result?
I think
result?
Yeah, the fresher the sample, the more accurate the result. It also, by having, if you're dropping a sample into our clinic, we as vets, we know how our lab works and how accurate our sampling is, and we can advise you because we know your horse, we know your management strategy on your yard. So I think we would be the best place people to be advising you on whether to worm or not to worm. If you send samples off correctly, be sampled correctly, and also you've made your sample as airtight as possible, you still can have accurate results from sending them away, but they just have to be packaged properly. It is slightly easier, and the samples are a little more forgiving if you're just dropping them into the clinic.
One other interesting question that's just come in. Would the antibody tests for tapeworms on the saliva test or the blood test, would they be affected by a horse that's on steroids?
I don't think it would be.
No.
Natasha's shaking her head.
No, so the antibodies, I understand this is a bit complicated, but the horse creates antibodies specifically to the tapeworm. Those antibodies remain in the body as for a definite amount of time, up to kind of 6 months or a year. Steroids affects the immune system, but it doesn't affect the antibodies you've already created. So they would still be detectable, just as you and I would still have anything that we may have found detectable if it's still present. So no.
Yeah, good. Okay, that's brilliant. Thank you very much, Emily, for answering all those questions. Also, Natasha. I think what we'll do is we'll hand over to Sarah, and she's going to talk to us about the treatment and management of parasites.
Thank you